Are you interested in what the nursing program has to offer?
The traditional BSN program is a pre-licensure program. You must apply to it. It's limited access, meaning not everyone will get in even if you declare the major and are accepted at UWF. When you do get into the program, it is what you call nursing school. You will learn everything from how to take a temperature to how to take care of a patient to the extent of what you will be as a registered nurse. Upon completion of the program, 62 credit hours, then you are eligible to sit for your NCLEX exam, which is a board, and upon passing that, then you become a registered nurse with a Bachelor's of Science degree. The room we're in here today is our simulation center. So in this room, the students will go through different simulations, role-playing per se, of different situations that they will come across or may not come across in real life. And it's to help the student build their confidence and knowledge base of what they would do in a particular situation. You're culminating, bringing together all of the different pieces that you've been learning through your prerequisite courses, through your nursing courses of, if this situation comes up, how do I handle it? You know, you could be looking at lab reports, you could be looking at drug interventions, you could be looking at many different things. So in simulation in this room, that's where we practice those things. All students also, almost every course has a clinical component. And so while they're here in the campus, they will learn the skills needed for that particular course level, and then they will actually go into the local hospitals under the supervision of a registered nurse, master's prepared or higher, and they will practice as a student in the hospital setting. So their first semester, they're touching live people. So it is very intense, and the reality is we are dealing with people's lives. So here on the campus, we're building your confidence, and then in the real world, you're applying it. Each student has a different component that excites them or naturally drives to them. Many of them thrive in simulation. Many of them, it's usually the clinical component, because that's when you think of a nurse in the hospital or the bedside or what have you. You don't think of a nurse in a classroom studying and getting lectured to. So that's the place that most students really start thriving, and you put all the pieces together that you've been learning for the past 2-3 years to get to there. If you are thinking of nursing or not sure if it's for you, just remember it's not about the paycheck. Yes, their jobs are there, and yes, they pay well, but if you don't love what you're doing, it's not worth doing it.
The nursing program here at the University of West Florida provides nursing students with a stimulation center and clinical skills. I'm Sarah Agins, reporting for Argo News.